Is it a big deal to own a toilet or have good sanitation? The answer may be no for a few Ghanaians, but for more than 22 million others, it is a big yes. Sanitation is a basic human right. Everyone in the world, especially children, should have access to at least basic toilets. Good sanitation prevents debilitating and often fatal diarrhea, particularly in children under 5. Sanitation coupled with access to safe water engenders good hygiene, which underpins health, education, and livelihoods, forming the first essential step in overcoming poverty. If governments take a shared responsibility to reach everyone with adequate sanitation by 2030, future generations will be healthier, with better life chances as a result. The unfortunate reality, however, is that far too many people lack access to these basic services.
When water, sanitation and hygiene services are available, community health status can improve. When water, sanitation and hygiene services are available, education outcomes can be better. When water, sanitation and hygiene services and facilities are available, we can experience poverty reduction and total economic and social development.
An estimated 2.4 billion people globally have no access to improved sanitation facilities. Of them, 946 million defecate in the open.
For water, we have experienced some improvement in the last 4 or 5 years, especially in access, because government of Ghana has pumped some little resources, especially to urban water. But the challenge with water still is that there is inequality in access, and that is why Wateraid Ghana is speaking to all duty-bearer, especially government, to be aware of. For sanitation, the situation is dire, and government must step up its action to release financial resources to ensure that sanitation is dealt with. Sanitation in terms of environmental sanitation, but most importantly, household toilet provision. This is crucial.
According to the 2015 Joint Monitoring Program report by UNICEF and WHO, 85% of Ghanaians do not have basic toilets, 60% using shared toilets, 6% using unimproved toilets, and 19% defecating in the open. To change the situation, Wateraid Ghana is undertaking a sanitation and hygiene advocacy program in 4 communities in the Ekuapem North District and 4 in the Kushegu districts.
The strategy under the GATES program is to do advocacy at the district level, at the community level, to ensure that first stakeholders get to know the problem. Once they get to know the problem, they can be able to solve it.
ACDEP has been a partner to Wateraid for the past 25 to 30 years, supporting communities in the water, hygiene and sanitation sector. Currently, we are working on this GATES sanitation advocacy program. We've been able to meet with the community opinion leaders and the assemblymen, and we've also engaged with focus group discussions to be able to understand the issues within these communities.
If you be waha, toilet in him, say, if you start to say, why a toilet? Now, near whom Musu, I have and say, a KVIP, obey a wolf, you can't even go. As a KVIP, no, a ma, not problem with Hukaka. You who quite a faso. Now, ye did KVIP, no, the Muasambe down.
I've been an amount for when you say a bambay, Baba Bob, no matter, or Missy Kiffy. But Uno Motinasi. No more moti as yes, a war or more who pine. A yoma said, yes, or musi tifia. Yana, Adreno, sa, sisa. No musai the SCTV. Yeah, at the 4. Any your partner, Wateraid for. And Church Omodia, Amaya, and Nay, Nina Mukrasia, ye cat, ye bodo ratcha. A month for say, and nay, so one born whom modern and see what tifia. A hard near my baby.
Once I miss the toilet, na me call a bank toilet. The crowd get in and crowd room clean toilet. This is what the things you have to say. Mr. Nettie, finish when you're obedient on train when you in Amono. And I may be Mr. Messi toilet.
You won't crow best in Boom or Mati Women's Hygiene Club. A man in Nan. Obi nkan tro mo se omo ko maji omo sorry no my dey omo prapra omo bro no aketwe bi enu
enam Wateraid fo nkyerɛkyerɛ pa omo de ma ye ne adem fo amen ne adom fo yesiesie pinkon a wonam ba bia kwa ho roba na ye hia ban so meboa ye ntua ye nka o ye hia niema ye hia hwibaro ye hia praye ye hia dustbin niema bebre na ban ye hia ne mmoa no meboa na Wateraid fo ne adem fo nga ya ade ene ye krom ha ate
ye krom ha na bia obefa bia street eda ho nti street no so o ma anye ne kese a ka betumi afam nti eno ne ye nga ba ko a entumi ma ye nsi toilet ewe ye mfie mu but ye nya sa ankyekere we ne adesua we no ama ye hu se ye se de ti bia no ye betumi aye toilet we ye mfie as individuals nti no ama nipa bebre a sha ase a worry your toilet in fear.
At least 25 households have latrines so far.
Toilet na ya kosono. Na enye omo ne ni gu ho basa tutu gu ho tantanta ya compound na area no. Tantanta nti sa ankyerɛkyerɛ na mo de ma nti yen se bo mo de na yesi ye dey e wa ha na ye wo how pi say ye be ko aben ye finish no. Na how ye ni nti meti dawuru ya ti dawuru na mesre me message asem abani ti ombo ai ni emesi ti efinu na sa how no je fisa obako amansa de no so no ni abehu no wompe
me wo 5 bars of cement me share say me de beye ba sisi anyama nko yie man tim mama chopi akra ejuma so start se nyame ya dum na say ejuma pie mam dia it's missing that because we go to one kakra.
In the Gushegu district, Wateraid works with New Energy to encourage the communities to build household latrines.
I support community development in the sensitization and animation of communities. I also support in facilitating groups formation and then training of advocacy groups in each of the 4 communities that this program is being carried on. In our community sensitization process, we do carry out community mapping. Our community mapping allows the community people to demonstrate on the ground how their environment looks like. It gives them the opportunity to demarcate present facilities that exist in the community, including wash facilities. So they will know what aspect is their loopholes, and they work towards achieving that. Community groups, through our strengthening of their capacities, have been able to improve their present situation, considering the number of latrines that they are able to build, considering the hand washing facility like the tippy tap they are able to put, and then the general environment has been a different thing altogether. So I can say that community groups are now having the capacity to engage local government for their wash services.
A year on, communities have taken the issues of sanitation and hygiene seriously, and the progress made is evident. Many people have taken the initiative to build latrines for their homes.
Communities have really taken up self-leadership, like they're motivating themselves to transform their communities as a key first step before or as simultaneously engaging with the district duty bearers. And this has really shown how we as an organization, if we are open to learning from the community and learning with the community, the ability for us to achieve change becomes more possible.
In Gushegu district alone, a total of 60 latrines were built. They also put up tippy taps to aid in hand washing. A total of 46 were installed.
Ninya fani sheldi mane. Nyela try dam gra banjete. Nsongni gweli morne. To amata min bani jinda. Pumpong timnyela banjete. Aile ndam go banjira belen chang moane. Ayen kele banjira mane. Nti dam ga patja agunan kas.
Te nyar tansam. Joi sashe tendaba mini di dam go banjira. Nsong sambane tali nyele. Ama ban chete ta bang ban shisha din je da pune domi tanan dai kule ngina gbayan ba sa'ara yan ba ala sa'ar ma aku fashi to mun fo mi famalla ta da ala bula nzana sa'ar ma ta kpar ba har din mai banjirte di ma yan dam go banjira ma na ko yanki anta dam go banjira ma hala ayi kan ko damgul son ayi kana ayi zang la banun korseli zang kentin nan banjira ma ko tam bu an shelem ba
kumfon lala new energy mine Wateraid nim na kana to bu an yela pambo san zan chang den tune te mal banjir bi ti yes sham da ren tune te para tunu ne chibo kana yi dibindirgo sham am zan chang kama ne den tune te nan sham ka te tengban be kashi ka dara kana ka dunse ko to dimte ka tinye dorshanga bene ka bon le pa ja ta ni mane te bo ande zaha la bo ande yen non sham ka te to gbabe te be venyan ka mal alafi ka to chan be shokote ka tan mamman gbato mal saa ntumna te putumanu.
However, there is more to be done. The government must improve access to these basic services, and this must be a priority. This requires increase in funding to solve sanitation problems. At least annual budgetary allocations to sanitation should be a minimum of 0.5% of GDP for sanitation and hygiene. However, the current allocation is rather 0.2% of GDP.
With the Gates Sanitation Advocacy Program, I'm expecting that the municipal assemblies will increase their funding to the sector, especially sanitation, so our communities will be able to get a fair share of that allocation. Also, it will require that there will be quite more frequent interaction with the local assembly officials so that they will be able to solve some pertinent issues that communities have.
Wateraid remains resolute in its efforts at improving wider access to water, sanitation and hygiene (WASH) in Ghanaian communities. The aim is to achieve universal WASH by 2030. That is, everyone everywhere in Ghana will have access to safe water, sanitation and hygiene.
Wateraid Ghana interventions in the water, sanitation and hygiene sector has revealed that if stakeholders can pool resources together in a coordinated manner, the sanitation and hygiene challenges we have in this country will be solved. The other revelation that we have come to realize is that sustained behavior change communication at the community level can be able to help communities get to the aha realization moment. And when they get to the aha realization moment and they have facilities, then behavior practices can be changed for the better. Most importantly, financing is crucial for government of Ghana to do. Once government of Ghana is able to improve financing, universal access is possible by 2025 as contained in government-owned policy and strategy documents. WASH access everyone everywhere by 2025.
Water, sanitation and hygiene are directly linked to development. As we work to improve the standard of living of everyone in Ghana, let us prioritize WASH to propel us to achieve our desires and aspirations.